Hello, everybody. Dr. Wickham Simonds here. This is Michelle Kennedy, nurse practitioner, Dr. Simonds Metabolics and Weight Loss. This is the Ask Me Anything Facebook Live event. First one in February, right?
Yes.
February of 2022, in case you're watching this at some point down the road.
All recorded.
That's right. We're answering weight loss questions. We're open in both our offices, as we always are on Mondays, or almost every Monday, unless it's a holiday. You have a chance today, as always, to win a $25 Target gift card. You have to like this video and in the comments section, put hashtag Simonds AMA. That gets you registered to win the gift card. We'll announce the winner by the end of the show. First up, before we answer any questions, you've heard me and Michelle talking about some non-surgical body contouring services that we're going to be offering, and we're going to be launching a new channel on our website this week. We want you to stay tuned for that, about that. And so we just want to give you a little preview, a sneak preview of that, and take a quick tour, show you kind of a sneak peek, a quick tour of that. So, Madam Producer, fire away. There you go. See, we use some really cool stuff here. And we outfitted an office space next to our Durham office. We rented the space that was next door and outfitted it to be kind of a really cool, relaxing experience. And we have some great technology made by a company called InMode. We have 3 different machines, Evolve, Evoke, and Morpheus, that do non-surgical body contouring, and it is excellent. These machines work great on people who are losing weight and have lost weight. So we have a nurse specialist, Anna, who happens to be my wife. She's a registered nurse. She's trained to do these procedures and does a lot of them, and she will give you a free consult. You can go with just about any body part from head to toe that you may be concerned about and wonder, hey, will this technology work on me? Will these kind of procedures help me? And she will be glad to look at you, explain what's involved, and tell you, yes, you are a candidate. No, you're not a candidate. What kind of costs are involved? What kind of time is involved? And we will not put a hard sell on you. Okay, we're not interested in hard selling anybody or any of that sort of thing. So it will be a pleasant experience, I promise, if you take advantage of that free consult. And you can call our office, and they'll be glad to take your name, and Anna will reach out to you. And on this new channel, it's going to be a video tour of the new center, and you'll want to check that out. It's really, really cool.
It is.
Yeah.
Now,
really
we've had
nice.
patients do this already. So we have experience,
Yes.
and I've experienced patients who have gone through treatments on neck, on arms, on abdomen, and I will say everyone has been extremely happy with the results and the experience as a whole.
Yes. Yes. So we're gonna play that video right now of the tour.
Look at that.
All right. Stay tuned. Here it comes. Hello, everybody. I'm Dr. Wickham Simonds from Dr. Simonds Metabolics and Weight Loss. And I'm here today to tell you about our new body contouring center. Standing next to me is Anna Simonds. Anna's a registered nurse. Anna's my wife. And both of us have been trained in these techniques to reduce body fat, tighten skin, and tone muscle. We have some outstanding technology and machines that do this. And today we want to give you a tour of the center. Dimmed the lighting down and made the decorum such that you will always feel relaxed when you come here. Unlike our weight loss center, the body contouring center, you'll be the only one here getting a treatment when it happens. So the place is really kind of dedicated individually to each person in a relaxing environment. We usually play a little music. We have Wi-Fi, so you can use your iPad or iPhone or Android, whichever kind of technology you use. You can access the internet. Okay, so that's just a quick video tour. We're going to be sending out more info on the emails, so stay tuned to those. And remember, we offer free consultations. As you can see, look, we did a nice job in making that kind of a personalized, relaxing experience. It's a little bit different than what you experience kind of in a more high volume setting in the weight loss setting that we have in both offices. So it's kind of set up to be more relaxing.
Yeah.
And,
much more spotlight,
yeah, right,
for sure.
Exactly. So, Michelle, what do you say we get into the questions here?
Let's do it. And don't forget to enter for our gift card. I haven't seen anyone yet. By the end of the show, we really want to give away a $25 gift card. So like this video and hashtag Simonds AMA in the comments for us. So we're going to jump in with Jill from Raleigh. Jill says she's been diagnosed with PCOS and needs help losing weight. Do we have experience with this? And absolutely, yes, we do. PCOS stands for polycystic ovarian syndrome. PCOS is a very, very common hormonal disruption that a lot of women experience, and it can be related to weight issues, it can be related to fertility and irregular menstrual cycles, and generally it is hallmarked by having more testosterone as a woman. And that drives things like the irregular menses and fertility issues and sometimes acne and hair growth. And again, it's very, very common. But what ends up happening is a lot of women who have this syndrome are somewhere on the spectrum, because it can be more severe or it can be very mild. But a lot of the times it is the high insulin level that we're really needing to target, because when insulin's very high in the body, it sort of tells the ovaries to make more testosterone instead of just the progesterone and estrogen balance that we want. We want a little testosterone, but too much is not great for our bodies as women. So by targeting insulin, by helping with blood sugar and carbohydrate restriction, we really can not just get the weight off of PCOS, but I've had patients who have completely had their PCOS resolve, and they've been able to get regular cycles again and become pregnant. And it's been so rewarding. So Jill, don't hesitate to give us a call and let us know.
Yes, I agree with all of that. I think that's a good summary.
Yeah. And I will just mention Metformin, because we talk a lot about Metformin. This is a really perfect situation to use Metformin. Metformin is a medication that has been around for a long, long time, traditionally used to treat diabetes. However, in obesity medicine, in our specialty, we all use it a lot for targeting high insulin levels. So in addition to a low carbohydrate, anti-inflammatory type diet, using Metformin can really help bring insulin down and therefore normalize the testosterone issues that women with PCOS have. So we don't just have dietary interventions. We'll have medications that can help you, Jill, as well, to really target that issue. Anything else for that, or should we move on to Colleen?
Let's move on.
Okay.
Let's move on to Colleen.
Colleen from Durham says, it feels like I have tried just about everything to lose weight with nothing working. Any advice? We have so many patients who say this, don't we?
There's always a solution, Colleen.
Yeah.
There always is. And I think if you can get a grip on what you're doing, if you know what you're doing with precision from an intake standpoint, and you know what you're doing with precision from an activity standpoint, and you understand kind of where you're at behaviorally. Now we can work with you as far as medication, but it's going to take a change. I always say you can't do the same thing and get a different result. You just won't. I had people come, for years, I had people who would come in and tell me, I'm doing this, that, and I would suggest maybe, this is kind of like before low carb was popular. Mm-hmm. And they would tell me how they were doing all this low fat stuff. And mm-hmm. They didn't understand why they weren't losing weight. I would suggest low carb, and they were like, but I'm already doing the right thing. And I'm like, and it's not working. Okay. If it was working, you wouldn't be sitting in my office today. So we got to make a change, right?
And it's hard because a lot of us are told by our providers, you need to just do it harder. Eat less calories, eat less fat, exercise more. But honestly, if something's not working, it doesn't necessarily mean you have to do it harder. It means you need to do something different.
Yeah, that's right. That's it. So that's the first principle right there. So we run into this, by the way, with low carbers. Now low carb is popular. We run into people that really do low carb, they get stuck. Okay, maybe it's a matter of putting them on medicine. Maybe they're exercising too hard.
Yeah, and we even have a question about plateaus from Ethel. What do we do? And the same answer. We change something.
You got to change. Your body memorizes. It's an efficient biological organism. It memorizes exactly what you're doing and adjusts accordingly. So you'll have to make some changes, and we'll need to sit down and talk with you. If you're not a patient, this will be a good time to become one. If you are a patient, it's a good time to come back. We can help you, and you need to tell us where you're at, and then we need to get a grip on what you're doing, and then so that we can kind of then make some constructive suggestions on how are we going to break this, right?
Exactly.
How are we going to break this?
Thank you, Ethel, for that. It was actually really pertinent to the questions that were done.
A lot of times, maybe at that point you're just on one medication. Maybe you need a different dosage of the medication. Maybe you need a second medication. That may just be a move that simple to break that plateau that you're on.
Yes. Yes, exactly. So don't feel discouraged, right? A lot of folks feel the same way. That I've done everything. And that doesn't mean you've tried everything that there is out there, right? So
one other rule I always tell people, I said, if you want to just break it down, you don't, it's not like when you go to medical school or a nurse practitioner school that you get all the special information sometimes that no one else has. There are some things that are universally true, and I always say in starving countries where there's famine, people do not die overweight. They don't. They die very, very thin. Okay, so now that intermittent fasting is popular, I tell people a fast will always break a plateau.
Absolutely. It's something we suggest a lot.
That's right. So if you're looking for a simple answer, now a lot of people can't do it without medication, right? And they can't do it unless they kind of got adjusted to a low carb diet first and got used to burning fat. But something like that is actually something that always works, and it's based on that principle. Your body cannot, under the circumstances of forced starvation, it cannot remain overweight. It has to yield, and it will, and that will break any plateau. Yeah.
Absolutely. We have a comment from Tim. Awesome group of providers with awesome results. Down #75. Oh, thank you, Tim.
Yes,
congratulations. Tim. So Tim is, I have to say, one of our best patients. I mean, I love all our patients.
He's down.
Oh, it's amazing. So thank you, Tim. Thank you.
Right. Yeah, we really appreciate it. Appreciate you telling everybody about us.
Sarah saying she's a current patient. She loves the group. Thank you.
Thank you, Sarah.
We're so glad you're a part of it. And it really is kind of like a family around here, right? We've been open for many, many years. I've been here from was 10. You've been doing this in the Triangle for far longer. And we have patients who we have seen every month for a decade.
We get to know. We get to know folks,
they're
right?
Family.
That's right. We get to know a little bit about everybody. I really like that. So.
Thanks for joining.
This is Dr. Simonds, Metabolics and Weight Loss. Ask me anything. Facebook Live. Dr. Simonds here. Nurse practitioner Michelle Kennedy here. And we're giving away a Target gift card.
It looks like Sarah has entered. Anyone else on there?
Gotta like us in the comment section. #SimonsAMA. That's how you get registered. By the end of the show, the producer will make a drawing. And right now, if the show ends, Sarah's going to be the winner. She's the only one in there. Come on, Tim. Get your name in there, brother.
And Ethel.
That's right, Ethel. Get your name in there. That's right. So we're open in Raleigh and Durham today. And as always, and we're answering weight loss questions. Kathy from Morrisville. I like this one. Are sugar substitutes safe, and how much of them can I consume each day? I don't think anyone knows the exact answer to this question.
There's no one right answer.
And just like everything else, there's always an answer. There's 1,000 answers you can find on the internet. As some of them are garbage and some of them are good. Look, there's. I'll kind of say that there's not all this information out there. It's not like the U.S. Food and Drug Administration or the United States Department of Agriculture has decided to purposely, in cahoots, put out a bunch of poisonous, sugar substitutes, tell you to consume them so that you'll get cancer and die. and they're all in cahoots lying about it. That's not what they're doing. So look, I don't know how healthy they are for you. Okay, there is an absence of data suggesting that they cause all of these health problems. All right, I happen to think that a diet that's whole and without stuff like that is great. I happen to think that real sugar, refined sugar, is the problem. Okay, it is, and whatever its form, whether it's high fructose corn syrup or table sugar or whatever the name of the stuff is. So the way I look at it is the refined sugar is poisonous. It never was in nature and doesn't belong in our bodies. The sugar substitutes, from a diet standpoint, are not the enemy. They're probably not the best health move you ever made. And if you want to be a purist, get rid of both of them.
Yeah.
Okay. And that may be a journey. So if I got somebody that's drinking real Cokes and they say, do I have to stop those? I say, well, you can drink it. How about Diet Coke or Coke Zero? Would you do that? And if that's the stepping stone, I'll take it.
Yeah.
Okay. Yeah. I'd rather them do that than say, I have people now, by the way, that come in and say, I got to drink the real stuff because I know that diet stuff is bad. It's going to cause me cancer and all those. And I'm like, no, it's not. No, it's not. But that real stuff is going to take you to the grave quicker. That's the way I view the real sugar stuff. Okay. I don't want to pick on that particular brand, by the way. So if you're over there, Coca-Cola, I apologize. And if there's any kind of brand with added sugar, I just think that, is probably not good for us. Okay. That's the way I view it. Now, in that scenario, I try to tell people in the end, you want to get to real filtered water. That'd be the way to go, right? Okay, but if you're not there, that's cool.
Yeah,
I get it.
I totally agree.
And I think that, look, Ethel, I'm going to get to your question in just a second, but as I finish up on this, I would just say that, I don't think that we're going to get in a situation where our patients are getting beyond some sort of toxic dose of these sort of sugar substitutes, to finish up with Kathy's question, right? Okay, there's not we don't run into that scenario. Yeah.
And I'll just say real quick before we cover your question, Ethel, the thing that you'll hear us say a lot if you're a patient in the practice is, is this okay? Is that okay? We'll try it. Is it okay for you?
Yeah.
Because some people will find if they eat too many bars or shakes or products that are meant to help but have a lot of these artificial sweeteners in them, they may not lose as well. And that could be a lot of different variables really. Maybe they eat more of them, maybe they eat more often because they're tasty or they're sweet. But generally speaking, Kathy, if you can consume some and you are still able to lose weight or maintain weight and achieve your goals, that is the answer to your question.
That's right.
Of can I or can't I?
That is so true. That right there that's right on the money. All right, so Ethel's question, is it advised to use HCG more than twice a week? The answer to that question is no. Yeah, answer to the question is no. All right, let's go on to Helen from Raleigh.
Yeah, so Helen is asking, what kinds of supplements are recommended to help speed up weight loss? So we prescribe FDA-approved medication that is very assistive when we're battling the conditions of overweight and obesity. And supplement-wise, there's a lot less research out there. There are some things over the counter, if that's what you're referring to. There are some things that can help. So amino acids have been shown to help, and there are some things that claim a lot about speeding up weight loss on the market, fat burners and whatnot. A lot of them are just vitamins and amino acids that can be helpful, but the mainstay of treating weight is pharmaceutical medication, with, of course, the lifestyle and the behavior changes of the diet and the exercise. But as far as the medications, like I said, we prescribe all the FDA-approved medications. There's nothing we won't prescribe. We don't have a ton of options, but we do have a lot of really good ones, luckily. And we have a lot of experience in our practice of using them in combinations, in different doses, in different timings based on your schedule. So we can really tailor to you, Helen, what your needs are. Is it all day hunger? Is it just nighttime cravings? Everyone kind of has their own battle, but we have some really good options, I would say, to help. Yeah,
that's right. We do. And so, for people who've never tried prescription medication to help them lose weight, and maybe they've been buying supplements. It's always an eye-opening experience.
Very different.
Yeah.
Very different.
Yeah, they are like, wow, why didn't I do this before? So I agree with your comment. I mean, I think a lot of supplements market themselves as speeding up your metabolism and all that stuff. And it's really hard to substantiate claims like that without any outside scrutiny to your product and any published scientific data. So it's hard to say. And there have been a lot of products over the years that have come and gone that really didn't do that, that claim to have done that. So anyway, the stuff that we prescribe to you here really helps. And we know that. We know that if you take patients doing the same diet and we add the medicine to it, the one that's doing the diet with the prescription medication is going to lose more weight than the patient just dieting without the prescription medication.
Yes.
Yeah.
Yes. And we're going to tailor, what your long-term plan looks like, because I think there's been a misconceived notion that medications should only be used for a very short amount of time to jumpstart, and then you should be able to do it on your own. And that's just not the case. With weight, this is a chronic, progressive, relapsing, very complex, very difficult to manage medical condition, and no one should be expected to do it by themselves in the beginning or through the entire rest of their life. So for those patients who say, this helps so much, I'm really scared what's going to happen when this gets taken away or this tool is no longer part of my plan, we say that doesn't have to be the case. We will work with each individual person, and all of the FDA approved medication recently, like over the past decade, always approved for long-term use, right? There's no medications coming out now that are only approved for 3 weeks or 3 months or even a year. They're all approved for long-term treatment of weight. So we can discuss, what that looks like for you, for sure. Looks like we got a question in comments from Karen. Why is it so hard to lose weight as you get older? There's a lot of reasons. The main one being, especially for women, a drop in metabolic rate due to the hormone changes that come with the perimenopausal and menopausal period. A loss of lean body mass is associated with that, and our muscle is really what drives our metabolic rate. So strength training as we get older as women, very important, and eating plenty of protein, very important. Yeah,
that's right. And I would just, this is a good question. And I would say historically, you might, if you didn't die from cholera or falling off a roof or getting run over by a horse or something, women and men weighed the same at 70 as they did when they were 18. This pattern of weight gain is a historically modern phenomenon that is common to the era of refined sugar and flour, okay, and modernization and driving cars everywhere and a decrease in activity. So although there is some decrease in metabolic activity, it's relatively small. The other part about the change in estrogen, progesterone, and testosterone, for example, is you get a more profound insulin response in response to carbohydrates. And then in our ancestors, they couldn't go down to the store and get all this flour and sugar and stuff like that. They couldn't get it. They had to go out and kill animals and grow stuff in fields, all right? And then they had to work very hard to harvest those things. And so their diets, they didn't eat anything that would raise their insulin level. So today's diet, it's just like monkey see, monkey do in the United States. I want this, and it's flour, and I've always had that, and so you do it, and now you're in these perimenopausal and menopausal years, and the insulin response to that stuff is much more pronounced than it was when you were 25 years old, for example, and that high insulin level is driving that fat storage, and so this is why it's a problem, and so this is the case. Michelle, you're right. The resistance training matters, eating protein matters, and cutting out those carbohydrates matters. It's an American problem, and we got to, we really have to stop that stuff, because as a nation, we can't afford to go on, paying for all the complications that result. Eventually Medicare goes broke and we say, you know what, we can't pay for diabetes and all this stuff. And hey, why don't we stop eating all of this stuff and start eating, animals, what comes from animals and what you grow in gardens, right?
Yeah.
Okay. Oh, that's what we always ate, right?
Yeah.
That's right.
Yeah, and be less sedentary. It's also very true how you talk about like our ancestors and different cultures. There was no retirement. They kept being productive members of the tribe, of the culture, of the society, no matter the age.
That's right. Yes, that's right.
So that makes a difference too, right? Even if you do retire, good for you. That's great. But stay active, right? Have reasons to get up and do stuff and move and enjoy having a body that works for you, no matter your age.
Yeah, that's right. Okay.
So thank you, Karen.
Thanks, Karen, for your question. All right, Ethel, what is a good amount of time to start regular exercise and how often? Well, first do something if you're not doing anything.
Yes.
It doesn't have to be fancy. I always say, our ancestors didn't join the YMCA. They didn't have them. They just walked everywhere, right? So walking parks, stuff like that. So I think that you want to listen to your body. You don't want to injure your body. So if all you can do is 15 minutes of walking, that's what you do.
Yeah.
Right? If you can do 30, and I don't want you to hurt your joints and your back, for example, doing it, right? So you do some, and then boom, to the point where you're not going to injure yourself, and then make it a consistent habit, and then you try to add on a little bit each week. That would be the principle.
Yeah, absolutely.
Okay.
Great.
So we got a couple minutes. We got a couple questions. Let's try to rifle through them. Ratika, how do I handle my cravings for certain foods? I'm going to answer this real quick. Cravings are an addictive thing. Okay, that's what they are. So you're addicted to the food. If you were addicted to drugs, you stay away from drugs. You don't go down the corner where the guy's selling the heroin if you're addicted to heroin. Get away from that stuff. All right. You don't go in the ABC store if you're addicted to alcohol. You say stimulus avoidance. Get it out. Okay. Get it out of your household. Stop going to events where they push it in your face. Tell everybody I'm swearing off of that stuff. I don't have any problem with that. I go through periods like dry January. Guess what? Hey, I'm not drinking anything, everybody. Don't bring this stuff over to my house. Don't invite me to the events, and everyone's cool with it. That's the attitude there, okay? All right, if you need medicine to help with that, we got that. Come on in and see us.
Yes.
Brittany from Gardner, what is the best multivitamin to take while on keto? We got one here in the office. It's by Metagenics.
Very good one.
And it's the best one out there. Phytomulti, right?
Yes.
It's the best one.
Yes. There are a lot of multivitamins out there that are not great. So you do want to be picky about this.
That's right. Yeah.
You really do.
So we sell the best one.
Yes.
All right. So thanks for watching today. Give us a call. Come see us. We're here for all your weight loss needs. Remember to sign up for our daily emails. Tomorrow is Tasty Keto Tuesday. Today's winner of the $25 gift card.
Tim!
That's right. The referral machine himself, Tim. Tim, you're the winner. We'll get in touch with you about that. And congratulations.
Thank you for everyone who entered.
Yes.
Please come back in 2 weeks, enter again.
Thanks for tuning in, everybody. We'll see you in a couple weeks.